Vaccines play a crucial role in saving lives. During this time of pandemic, vaccines give us another layer of protection against deadly viruses and diseases. Now, as we celebrate World Immunization Week, we take a look at the importance of immunization in improving the health and well-being of everyone, especially the most vulnerable sectors of society, including children. With us this morning is Dr. Carla Ante Orozco. She's an immunization specialist from UNICEF Philippines. Good morning, Doc Carla.
Good morning, Paula.
It's a real pleasure to have you. Now, thank you for joining us. Doc, we're more than a year into the COVID-19 pandemic. How did it affect the immunization of children against other diseases such as polio and measles? There's a lot of, how would you say, hesitancy and mistrust almost nowadays.
Yeah, well, the global COVID-19 pandemic has really affected our health systems globally and including the Philippines. First, health workers are being diverted to support the outbreak response. This includes, of course, COVID-19 vaccination, which affected the delivery of routine immunization services, especially for children. In some places, children are missing out already on on critical vaccines due to community quarantine measures, health facility lockdowns, and of course, the fear of mothers and caregivers of COVID-19 infection. And this has reduced access to health services for most of the mothers and caregivers. So as a result, in 2020, only 62% of children were vaccinated, which is far from the target of 95%. So this brings us to a high risk of possible outbreaks of measles and polio. And children who are living in disadvantaged communities are most vulnerable. So these are areas in the geographically isolated, disadvantaged communities, in urban poor communities, as well as communities in conflict or emergency areas.
Right. Doc, you seem to be talking about a lot of children missing out on their vaccines, mostly due to the fact that you say people who actually deliver the services have been diverted. Obviously, access is a little more difficult given the fact that we're under community quarantine. Is it that, or is it also the fact that people are a little wary of vaccines altogether, coming from recent, how would you call it, somewhat controversial vaccine issues?
Well, yeah, that can also be true. There has been some vaccine hesitancy even before the pandemic, but also just to say that even before the controversy on a certain vaccine, there was already a decline in the immunization uptake and services. So as UNICEF, we are really providing this information that vaccinations, they are really one of the most cost-effective public health interventions that has ever been implemented. It's really a wonder of it's a medical wonder, actually. And because of vaccination, millions of children have we save lives. So we want to emphasize that vaccines are safe, they are effective, and in public health centers, they are free.
Right. Okay, vaccines bring us closer. Now, that's the theme of the World Immunization Week. Basically, organizations like UNICEF aim to cover lost ground and immunize those who have missed their routine vaccination. So how does UNICEF Philippines plan to address these issues?
Okay, so the UNICEF has been supporting the government of the Philippines for many, many years now. UNICEF is actually celebrating its 75th year in the country. So we support government in different aspects of the implementation of the immunization program. We support them in the supply chain. We provide support in procurement of vaccines. We also provide support in the improvement of cold chain facilities. So we even got support from the government of Japan to do this, to procure more cold rooms where vaccines are stored, also vaccine fridges and temperature monitoring devices. So this would be a big help to the country's immunization program. We also support through providing trainings on infection prevention control, as well as interpersonal communication. We also provide support in working with the Department of Health in developing communication plans, communication strategies to provide the right information to the public, and as well as provide support or technical assistance on the ground to working with communities to support the immunization program.
Fantastic. Excellent stuff. Doc, we want to say thank you so much for being with us this morning. That was Dr. Carla Ante Orozco from UNICEF Philippines.